My name's Colin Castle, I'm 50 years old. I live at Narangba, which is a suburb just north of Brisbane. I live here with my wife and my son. My daughter's moved out recently. This is like our oasis. We enjoy the solitude of our block, which is great. We've got 4 chickens and a dog it's about 4 months old. My journey through leukemia started in 2010. I was giving blood at the Red Cross, and one day they discovered that my iron was a bit low. So that led me to having ongoing blood tests every 3 months. And during those blood tests, the doctor at the time picked up that my white blood cells and my lymphocyte count starting to increase. He thought at that time I might have been sick and fighting something off, but as it turns out I wasn't. And they continued to rise, and then it got to a point where he referred me to the haematologist, and haematologist then had a further look at the bloods and came up with a diagnosis that I had what's called CLL, which is chronic lymphocytic leukemia. It's a longer term type of leukemia, so it's not one that you need treatment immediately. It's one that you may live with for a long time or may not need any treatment at all. So the diagnosis at the time was, let's watch and wait and pretty much try to live a healthy lifestyle, and we'll just keep checking every 6 months. When I got diagnosed, it sort of didn't really dawn on me that I had what was cancer, and it's not something that I still really think about to this day. I didn't share the news with many people at all. I didn't tell my family, I didn't tell my friends. It was something I thought, I don't really want people to be worrying about me, and it may never amount to anything, so I thought, well, I'll just sort of keep it to ourselves for the time being, my wife and I. And it wasn't until I'd be coming up on my 6-month visits to the haematologist that I'd actually start to think about it on a daily basis. But most of the days I just would go through living life normally and not thinking about it. Once I got the diagnosis, I tried to live a bit more healthily, tried to go to the gym, but that all changed in 2018 when my blood levels started to escalate quite significantly. I went and had a blood test, and the levels had escalated 3 or 4-fold from the rate they'd been growing. And that made my haematologist quite concerned. And it was at that time that I started really to focus on my health quite significantly. It was probably a little bit late, but I cut out my drinking for about 6 months and lost about 10 kilos during that time, which was quite significant. It wasn't until September 2019 that I actually started noticing some other changes within my body. I noticed that the glands under my arm and in my neck started to swelling, and got to a point where it was quite noticeable visibly if you were looking at me, or if I was sleeping at night under my arms, that it was quite aching and painful. At the time I was feeling a bit nervous about the whole chemotherapy thing. I've heard and read stories of how uncomfortable it can be for people and painful or traumatic. So that was something I wasn't looking forward to. One point I did think, well, it's been nearly 8 years I've been living with this. Hopefully, if I go through the treatment, I'll be able to knock this on the head and just start moving on with my life. So from one aspect I was a bit nervous. On the other side, I was actually looking forward just to making some progress at last, because after 8 years of sitting there watching and waiting, it starts to play on your mind a little bit, and you start to think, okay, when is this cancer going to actually start coming? Is it ever going to start coming? Am I going to have a long life? Am I going to have a shorter life? Am I going to see my grandkids? That type of thing. So I think it starts to influence some of the things you do in your life, some of the decisions you make. On my first day, it was pretty much just stepping me through the process, letting me know what type of side effects I might have from the treatment, just checking on me very carefully throughout the day in case things were starting to change in my body or how I was feeling. But thankfully, in the first round of treatment, I didn't have any side effects other than a little bit of nausea. and managed to get through that first round pretty good. My treatment went for 6 rounds, so every 4 weeks, 3 days every 4 weeks for 6 rounds. As my treatment progressed, my symptoms started to get more pronounced. Started to get a lot of nausea and vomiting for about 1 week out of the 4. Thankfully, I didn't lose my hair and I didn't have any other significant side effects. My taste changed and smells would trigger the nausea. So just things like opening a drawer and smelling the closed-in smell of a drawer or a cupboard would just set me off. Thankfully, the side effects weren't that bad, and I really can't complain that that was the worst I had. If I had to talk to somebody that was about to go through it, I would say try to keep a positive outlook, and that's something I tried to do the whole way through, and I still try to do it today. If you try to look forward to life after treatment, I think that's the way to approach it. If somebody offers help or support, take them up on that offer, because I think people genuinely want to help. When I told everyone my news, I was amazed at the support I got. Just people that I weren't that close to reaching out to me more than they probably would have in the past. I did have a friend who did a world's greatest shave for me as a fundraiser. Managed to shave off and raise nearly $1,000 for the Leukaemia Foundation. I do have a very good bunch of friends that were incredibly supportive. My wife was amazing in terms of doing the things that I couldn't do, especially on the weeks that I was pretty much bedridden. It's just supportive from that angle. Emotionally, my family have always been very supportive for me, and I'm very fortunate for that. Waited about 4 weeks after my last treatment before I had to do some more tests. I had another scan, another bone marrow biopsy, another set of blood tests, and those results all came back with nil instance of the CLL or the cancer in my system. So nothing was able to be detected. So I guess in that instance I'm classed as being in remission. The thing will never go away, it'll always be there, but at the moment there's no presence of it in my body, so which I'm very, very happy about and very grateful for. For me, it's trying to get life back to normal and just starting to do the things that I really wasn't able to do for the last 6 months while I was going through treatment. Having this illness has certainly changed my outlook on life. I'm not planning too far into the future, trying to live for today, trying to do the things we want to do, enjoy the moments that we have with friends and our family, and that's probably the most important thing for me.